Hi there. My name is Cedric Dark. I'm the medical editor-in-chief of ACEP Now. And today we have a very special episode, an interview from Dr. Cara Borelli, our resident fellow, with Dr. Kat Lettang. Enjoy.
So, hi, I'm Cara Borelli. I'm the resident fellow. And today we're going to be discussing art. If you would go ahead and introduce yourself.
Yeah, hey, I'm Kat Lettang. I'm one of the third-year residents. I'm currently at Valleywise Health Medical Center. It used to be called Maricopa Medical Center in Phoenix, Arizona. And yeah, it's great to be here. Thanks for inviting me.
Mm-hmm. Yeah, we're really excited. So I was wondering, could you talk about, you have two different pieces that we're going to be discussing today. I was wondering if you could just start with describing your first piece.
Yeah, for sure. So the first piece that I'll talk about it's a self-portrait. It's the first adult self-portrait I've ever done, and it's called The Cost of Silence. So this is a portrait I did in around July of this year. It came sort of from a really painful place where I was trying to deal with all of the trauma of working at the front lines of the COVID-19 pandemic, and just dealing with the exhaustion emotionally and physically that comes with that, as well as my own personal struggles that I was dealing with at the time in terms of caring for myself, taking care of myself, and my interpersonal relationships. And so while I was painting this piece, I really focused on just painting a really positive light on my own face. It was kind of a cathartic feeling. And it sort of speaks to how healing it can be to reconnect with myself, my own emotions, and also reach out to help or for help with others. So The Cost of Silence is again what the title of the painting is called. And it was just the weight of carrying all of that on my own, and how when we open up to other people and when we care for ourselves, that a lot of that cost is suddenly uplifted.
Yeah, that's really interesting. So you described this concept of duality in your art. I was wondering if you could, and you talked about that briefly, wondering if you could touch on that a little bit more.
Yeah, for sure. So, in the sense of duality, I think that there's a lot of tension and ease and flow that comes with art, and I like exploring the idea of two themes within a single piece. So, for this, the central theme of that self-portrait is trauma, and it can come from both the workplace where I deal with the trauma of a pandemic, but then also my own personal traumas in terms of interpersonal relationships and even sexual violence. And so playing with those two things, which can they can exist in completely different parts of my life and in my mind, and being able to combine them into one single source is sort of what I was playing around with in this piece.
Yeah, and then it seems like kind of like a similar note. We have your other piece. I was wondering if you could talk about that one also.
Yeah, that one's definitely an idea of duality for sure. So the second piece is called Blood and Ink. And I can't take credit for the idea of the piece. That came from a friend of a friend. But basically what it is it's a portrait of a skull that I did with an ink pen on canvas. And then we actually put IVs into ourselves and drew off blood, and then we painted with the blood onto the skull. So the duality theme there is that we're playing with a medium that me and this other emergency medicine physician we're both really, really comfortable with in the emergency department. Seeing blood all of the time, having it all over us sometimes, and then moving it to a completely different context, which is, we were sitting on a living room floor painting this painting and putting on canvas, making it something beautiful and looking at the different shades. So it was interesting to sort of explore and play with that theme a bit.
Mm-hmm. Yeah, that's so interesting. I feel like I would not have been, I've never put an IV in myself. I don't think I would be bold enough to do that.
Yeah, honestly, we kind of struggled.
Yeah, it's so interesting. How is it like painting like as a medium, just like physically with blood? Is it difficult to paint with?
It's kind of weird. It's to coagulate kind of quickly. So at first it'll be like blood that we pull off of an IV or on a patient. And then as we put it onto the canvas, it'll start to get dry. And then as the piece ages, the blood has gotten darker too. So that's been kind of interesting to see. It's a very dynamic piece.
Oh, that's really interesting. And I didn't really think about that, how it's going to be like changing over
oxidizing.
time.
Yeah.
How would you say that like medicine has affected the way that you create art?
I think it's definitely made me reconsider different themes. So one of the themes that I like to explore in art is like self-love, because I think that art can be a really good therapy for me personally. And then the other theme is like femininity. And so one parallel I've noticed in medicine is that so often with women's health. And it's something that we encounter all of the time in the emergency department. It's, technically half of our patient population, right? And so being able to make art about women or even for other women has been a really powerful experience for me and been very inspiring. And it's also, I think, helped me be a more empathetic provider for women in the department too.
Yeah, that's really interesting to see how like medicine's affecting your art and also like art is affecting your medicine. So,
yeah, for sure. It really has.
Interesting way. Do you have any people that you look up to like within the field of art, any artists that you say would be like inspirational to you?
Yeah, I do. So right now I'm really into an artist named Jana Brake. It's like Gana. So she's mostly a watercolor artist. She does a lot of portrait, and these portraits are quite fantastical on these huge, huge paintings, where it'll be playing with themes of femininity again, nature, wildlife, women in nature, and couples in nature. I think that the way that she paints with the different colors and then also pushing the boundaries of humans interacting in nature is really, really striking to me. Her stuff is super cool, so I recommend checking her out. Another artist that I really love is Colleen Ross. She's a little bit of an older artist, but she's a really great, beautiful oil and acrylic painter. So she just paints the human form so beautifully. And then actually my background before medicine, I was a musician. So I think I derive a lot of creativity from other musicians. So two that I really love right now, or I've loved them for a long time, but they're always just pushing the limit of what they're writing and creating, is Esperanza Spalding. She's a jazz musician and composer. And then Brandy Carlisle, who's a little bit more mainstream. She does a lot of really powerful vocals.
Oh, interesting. What area of music were you?
Yeah, I was a classical and jazz professional trombonist.
Oh wow!
Back in the day.
Interesting.
Yeah.
Oh wow! This is like a whole nother video that would be really interesting to talk about, like music and medicine. But yeah, no, like music all these like creative forms that have a lot of like connection between them. But that's so interesting. So had you like painted before going into medical school, or was that something that you like started doing once you were training?
That's a good question. I feel like I've been making art in different ways my whole life. When I was a kid, I always loved art class and painting and just getting creative, getting dirty. And then I stepped away from it a little while when I was doing music, and I was just pooling all of that energy into my more musical side. In medical school, I felt like I didn't really have time to do anything. And then in residency, I found myself gravitating back towards it. I wish I had some sort of inciting event or story to tell you of like, oh, I gotta start painting and drawing again. But I think, I was just really feeling this itch to create something. And I might have been feeling tired or fatigued or just not really excited. And when I sit down and just force myself to create again and just play with color or different shades, I get that spark back and I'm able to sort of get more energy. So
yeah, I can definitely see that how that can be like a very like therapeutic thing, and how it's so interesting to like incorporate your back, like now that we have like all this like training and like anatomy to like kind of like like go back and like with like a new light to like see how to like look at things and how to portray things is really interesting. I haven't tried, I used to draw, but like just for fun, but I haven't since medical school. I'm like, I wonder if I would be better at it
Oh
now
yeah,
that I
you
have
should
a little
try
bit.
it.
But yeah, no,
Yeah.
I can see how it can be very therapeutic and like a way to like explore all these like different themes that are coming up. But yeah, this is really interesting. What made you submit to the ACEP portraits?
Yeah, I just saw it on an email and that they
Mm-hmm.
were looking to collect different art mediums, and I was like, oh
Mm-hmm.
well, for some reason I've created a lot of art this year, and I usually it's the art I create is not really something that I share very often. It's like all over the walls in my, it's like all over this, but I there were a couple of those pieces where I was like, wow, I actually feel pretty compelled to share this and see if anyone needs to see it. And it inspires anyone to start creating things too. So yeah, that's why.
Oh, that's interesting. Yeah, it was very like vulnerable, but very like beautiful. I thought that was really like the just really really great inspiration for like just creativity in general for like trying to cope with everything going on right now in emergency medicine in
Yeah.
a very different way. So thank you so much for showing that, and also thank you for doing this interview. I appreciate
Yeah.
talking to you, and I think that this is going to be really great to get out there to let other people be inspired too.
Oh, yeah. Thank you so much. It feels so good to be able to share my work with everyone. And it is definitely two very vulnerable pieces, especially the self-portrait. But if anyone is able to look at that portrait and its different messages and they take something away from it, then I'll be the happiest person. So thank you.